Now, you might be asking, why are there so many options? And it is a challenge to explain that. All of these combinations have slightly different side effects. And all of them seem to have, or definitely do have, activity in the sense that all of these combinations can treat and shrink the cancer again. One of the factors a physician might use or your doctor might use to discuss these different options with a patient or with you would be, how well are you? How well did you tolerate chemo the first time? Sometimes when people have very severe underlying medical conditions, using 2 drugs is much harder than just using carboplatin by itself. And sometimes patients themselves prefer to minimize the side effects of treatment, and in that case, 1 drug is almost always less toxic than 2. So that's when carboplatin may be a reasonable option for someone. The nice thing about carboplatin is you don't lose your hair. So if your hair has regrown, you get to keep it. And it's generally quite well tolerated. Apart from fatigue and nausea, it generally has very few other significant side effects. A recent study showed that carboplatin and calyx may be a little bit better than what is often considered the standard, which is carboplatin and Taxol. It's better because it seems to prevent the cancer from recurring a second time or a longer period of time, so it delays another recurrence more than carboplatin and paclitaxel does. When we're talking about time here, we're usually talking about a matter of several months. But more importantly, it's better tolerated. So it does not cause the nerve damage I mentioned earlier, and it does not cause hair loss, which is quite appealing to many women. This is a newer combination. The results from the study showing this benefit were only made available within the last year, and it is also a very expensive combination. So in some cancer centers or some provinces, it's possible this is not yet being approved. Carboplatin gemcitabine has also been shown to be an active combination, and it also doesn't cause hair loss, which is appealing to a lot of women. Likewise, it does not cause nerve damage. So there really are a list of options that might be discussed with a woman. To some extent, it will depend on the individual patient themselves, to some extent to where they live in Canada. And so it's, I guess it's good to know that there are multiple options which might be available. Oftentimes, as long as the cancer seems to stay under control and does not progress for periods of 6 months or longer, it is possible to continue treating that cancer with carboplatin, and sometimes with carboplatin and another drug. So some women get treated with carboplatin many, many times. One of the unusual side effects of having carboplatin over and over again is that sometimes you can develop an allergy as the treatment progresses. So often women will say, I never had any problems with carboplatin, I tolerated it very well, and then we start another round of treatment and they get an allergic reaction at the time of the drug infusion. That reaction might be difficulty breathing, rash, short chest pain, low blood pressure, basically anything from something very mild like itchy palms all the way across to a very serious allergic reaction. For some reason, it is most likely to happen when a woman is receiving her 7th or 8th intravenous injection of that drug. But it can happen at any time although more often as time goes on. Usually, if a patient is allergic to carboplatin, we have to stop using it because the risks of a serious allergy or an escalating allergic reaction are quite high. Occasionally, if the reaction is very, very mild, such as itchy palms in the hands, doctors might try to manage that with steroids or antihistamines. Every situation has to be weighed out, and the individual patient's circumstances have to be considered. We don't use intraperitoneal chemotherapy when ovarian cancer has recurred. And so if that is being discussed, then it would be considered a non-standard option. I think all of the major cancer centers in Canada would not offer intraperitoneal chemotherapy for recurrent cancer unless they were doing some sort of study of something new or different. So what happens, though, if a patient's been on carboplatin and now the cancer seems to be growing more quickly within a matter of just a few months of the last treatment, or else even as the treatment is ongoing, the cancer has stopped responding and it's now what we call platinum resistant. This is really a very difficult clinical situation, and unfortunately doesn't leave us with a lot of promising options. There are drugs available, and we certainly do try them, and there are definitely women who benefit from them. So we never know exactly who will and won't benefit unless we try.